Okay, so today what I'm going to do is I'm going to show you how to strip out a muscle called the psoas muscle. It runs through, in your stomach here, it runs through, connects from a point at your leg called the lesser trochanter, comes through here over the pelvic brim and attaches to all 5 of your lumbar vertebrae, in your lower back, and your 12th thoracic vertebrae. So it has kind of a wide span of attachments. And this muscle, when it contracts, what it will do, or if they both contract, it will cause hyperextension of the lumbar spine, which is not good. If it contracts on one side, it will rotate the lumbar spine. And so this becomes very problematic. Can cause lots of back pain, can actually simulate, it feels like you have a hernia sometimes when that gets really spasmed. And so what we want to do is dig that out, not only to restore function, but to get rid of the pain and dysfunction that it's actually causing. So we take something like this dimple ball, or you can just buy a softball at any sporting goods store, and you're going to take this. Now a lacrosse ball is going to be too small for this. You've heard me talk about it probably in other videos. You take the dimple ball, you're going to place it, okay, we're going to lay on our stomach, but you're going to place it, if you feel here, these 2 bumps, okay, those are points on your pelvis, okay, these are called anterior superior iliac spines. It doesn't really matter what the name is, but you're going to go medial toward the midline. You're going to go medial to that, just a little inside of that, and that's where you start. There's also a muscle in that pelvic, inside that, it's called an iliac fossa, but inside the pelvis, and there's a muscle in there called the iliacus. That sucker gets tight too. So you want to lay on this ball, and you want to put pressure as you're on your stomach and kind of dig, maybe move around a little bit, find a spot that hurts, breathe through it, 3 to 5 nice slow breaths. You can come a little more medial. Now, a lot of times to find the psoas muscle, we touch our belly button, we touch that ASIS, anterior superior iliac spine. We'll call it the front bump on the pelvis. You go between them, you bisect those 2 points and kind of dig in through there on a little bit of an angle and see if you can find it. You may think it's hard to find, but let me tell you, when you hit the psoas muscle, you're going to feel it, you're going to know you're on it. Just be careful now, you have abdominal organs in here. We want to stay on the periphery of those organs. We want to be on the outside of them. We want to be smashing on organs here. So that's why we're going to kind of come in from the outside, hit the inside of the pelvis, then angle it a little bit, okay, again, so maybe be hard to see on the video, but we're going to take that ball, we're going to place it here, I can bring my leg up, I can bring my leg down. In fact, what's easier is, if I keep my leg, the side I'm on, down, and the opposite leg, I bring it up, right, little Spider-Man position here, and so we're going to dig through, and it feels really good, but again, you're going to hit spots that it feels really painful, but when you are done, it's going to feel a lot better. What you're going to do is be, again, super careful not to be on abdominal organs. And again, we can dig these muscles out. These are strong hip flexors. We use them for so many things, so it's very common that they can get tight. Again, use it with caution. But again, this is something that can be very, very effective. If you have any questions, let me know. Stay strong. If you have any doubts, check with your physician before you do any of this, and I will see you next time.